Hi, I'm Ray, and I'm going to be going over the bones and bone markings of the skull. To start out with, we've got the main bones, which we've got the frontal bone, the parietal bones, the temporal bones, and the occipital bones. These bones are connected to each other through sutures. We've got the coronal suture across the top, the sagittal suture across the midline, the lambnoid suture back here, and the squamous suture attaching there. Looking at the temporal bone, we have the external acoustic meatus here, the mastoid process down here, and the styloid process in there, along with the zygomatic process. Looking at the occipital bone, we have the external occipital protuberance here and the pharyngeum magnum here. Looking at the face here, we have the maxilla, which is the upper jaw. And if I take the lower jaw off, we have the palatine process, as well as the palatine bone back here. We also have the infraorbital foramen here. Looking at the mandible, we have the coronoid process here and the mandibular condyle here, as well as the mandibular foramen back here and the mental foramen up front. Looking at the rest of the face, we have the supraorbital notches above the eye. We have the ethmoid bone deep in the eye socket and the lacrimal bone superficial in the eye socket. We have the zygomatic bone, which makes up your cheek, and the zygomatic arch attaching to the temporal bone. We have the sphenoid bone here, and the nasal bone up here, which has the vomer down the center.